Fantastic. Hello. Good morning. Well, calling from San Diego, California. It's morning for us. Thank you for inviting me for presentation at this Congress. It's my pleasure to be a part of this. My name is Dr. Navneet Boddu, and it's a little big topic. My topic deals more with the current treatment protocols, current applications, and near future. We're looking at how do we use our biologics to help our patients. So I so as I mentioned, I'm from San Diego, California. I practice regenerative medicine. I'm a regenerative medicine specialist. I'm a board certified pain medicine specialist and also a board certified anesthesiologist. So going about stem cells, the stem cells are broadly two kinds. They are either hematopoietic or mesenchymal. Now, the cells of interest or the mesenchymal stem cells we're going to talk about. So the reason why is the mesenchymal stem cells, they orchestrate the repair and regeneration. They're the main characters that by themselves and also engaging the host body cells does this repair and regeneration of the tissue. So the mesenchymal stem cells, they are the pathways how they help are through immunomodulation. It's got the anti-inflammatory effect, and then obviously the regenerative effect, which is the most significant. So talking about the source, so where do we get our stem cell from? The sources commonly are embryonic, but we have ethical issues and also possible tumorigenic issues. Fetal, same ethical issues. There's the new pathway of pluripotent stem cells. They are basically regressing the cells from the adult body into the pluripotent stage. And the issue with them is tumorigenic and genetic instability. And if you look at the options, the safest are the adult stem cells. Now, the adult stem cells we get in our bone marrow, but the problem is they are the same age as the host who donates the stem cells. So you get it from bone marrow, fat, and dental pulp. A lot of dentists do that. And the new fresh ones are the umbilical cord and placental cells. So the question is, why umbilical cord? So first, these are derived or taken from the umbilical cord of a patient who had a normal delivery via cesarean section. So there is sterility, number one. Number two, they make sure the baby is healthy. And then at that given point, the umbilical cord and placenta are basically medical waste. And how amazing that we can create a whole new life, help somebody with those cells. And the other advantage is they're highly proliferative and clonogenic. The clonogenicity is amazing with umbilical cord stem cells, and they do not have epigenetic changes. So the new, and then obviously there are newborn stem cells, least replicative senescence. The senescence is not set in. So they are like brand new cells. And the most karyotypic stability with them. And that's why I call them most stem-like. The pluripotency is what is really comes into play. So now, not all the HLA antigens are expressed on cells, so you don't have any immune rejection on these cells. So like I mentioned, adult stem cells are not tumorigenic. So we all have heard about these athletes getting this stem cell injections and exosome injections in their musculoskeletal systems more. That's where is catching the whole vibe, the whole society by. I mean, this athlete gets injured, they go down, and instead of losing a season, they're going getting this treatment. They're back in the same season in a few weeks. I mean, these are amazing recovery stories. So how about bring their cells and use it for other organs, and then see the results on a common population? So for this lecture, The evidence for prepared from randomized controlled trials only, and there are human trials. There is a lot more data with animal trials. And this treatment, um, again, we excluded use of embryonic stem cells and also intra-organ injection. There are some situations they do that. We excluded that in this presentation. So COVID-19 really pushed this mesenchymal stem cells into the forefront of the world in the treatment. There were some treatment protocols before, but COVID-19 really gave a big boost. And the interesting thing is in COVID-19, these cells were used on severely ill patient, critically ill patients. And then the data it came out of this, I mean, these patients did amazing. I mean, how amazing you give a new drug to somebody who's really ill and they perform well. I mean, you cannot give any other way the safety factor involved. So this is along with my friend Dr. Atluri. Um, we wrote a paper about using the expanded stem cells for COVID-19 as a compassionate care. And then right after then, the FDA gave an emergency use authorization for stem cells. And I am one of the few physicians in the United States that has actually followed the protocol and treated the patients with umbilical cord mesenchymal stem cells for severe and critical COVID and cytokine storm. We got FDA attorney involved. We went through a right or try pathway. I have given tens of doses for these patients, and the outcomes were amazing. I mean, these are the people who had a very slim chance of living, walked away from the hospital. So with trials, there are about 10 controlled trials and numerous case series about stem cells used for COVID. So it just lists the trials that was done, randomized controlled trials, 19 patients, there's some phase 2A, so it was good to see that even in the middle of pandemic, that some of the scientists and the doctors have taken up the challenge to do it a proper approach and publish it. So this is the data I got out of Miller Medical School, one of the first doctors who gave umbilical cord stem cells in the United States for treatment of severe COVID. And it was amazing because he looked like the factors, look at the, what do you call, inflammatory factors of the IL 5, 6, and 7, and tumor necrotic factors, and in the control groups, and compared to the stem cell group. That's the day 6. Look at the day 6 numbers. It is amazing, phenomenal. So that really propelled this stem cell. So the probabilities of survival, treatment group compared to the control group. So now, remember that these control trials were done on severe or critically ill patients in multiple countries. I mean, it's not just multi-center, it's multi-countries. So coming down, what did it do? Mesenchymal stem cells, it was a cure. In my opinion, it was a cure. It decreased the mortality, decreased the hospital stay. It immunomodulated the cytokine storm. We saw the whole data on that. And the most important thing is the organ regeneration. I mean, these are the people, if without the use of mesenchymal stem cells, would have had severe scarring and fibrosis and stuff like that. They did not develop that. That's amazing. And then no post-COVID long haul syndrome. And this is the best part. There are no complications. Given to the sickest patient possible, no complication. And so far, there's absolutely no drug can do this. So we all saw the ground glass picture of the, lung for the COVID disease, and this is a post picture. So talking about lung disease, let's expand from COVID to other lung diseases. Now you have COVID-19, which we already talked about. It's been tried in interstitial pulmonary lung disease. Very difficult treatment for this problem. The only option, I mean, they are on medication to control and slow the process down. The only option is lung transplant, and there are not many lung uh, uh, tissue to go around, or not many lungs to go around. And there are some countries which don't even have the transplant program. COPD, alveolar disease, fibrotic disease, ARDS. Look at the etiology. They're completely varied etiology. They come from all the sources. 73 RCTs, and the positive outcomes pretty much in majority of those. They treated in idiopathic pulmonary fibrosis. Same thing here with a rapid disc decline. Treated the ARDS, and there's absolutely no single drug that can treat all these different etiologies. So let's step down to musculoskeletal. Now, musculoskeletal is the most studied, and people and like I said, what also came into field is using on athletes. Got a lot of social media attention. So low back pain, that's the most expensive management has failed. I mean, you don't have many options for cure. And then surgical treatment for the low back pain without nerve compromise is a disaster. It's not just a failure, but a disaster, because the sequelae, the adverse effect of surgery is just hard to take care of. Now, Dr. Petin, he did a study, and he followed them 12 months. Now, some of the patients are 5 years into this, and he saw significant improvement in 70% of the patient. Now, that beats even any treatment protocol in medicine. And 40% of the patient had actually regeneration of the disc. I mean, that's never been shown before, and here we are. And he did this with this autologous bone marrow concentrates. FDA very successfully forces the doctors in the United States not to call bone marrow or fat stem cells as stem cells. They want to call it bone marrow aspirate, microfragmentation of fat, but at the end of the day, these are the progenitor cells, which are the key players for treatment. Now, there's no complication except for in some, maybe the procedural, but the cell complication, none. And it avoided 76% of surgeries. So here's a picture, patient before and after, it's 12 months. L45, look at the disc. The hydration, this is normally, you want to see the hydration. That's a nucleus pulposus, nice hydration. 4-5, barely any hydration before. 5-6, a little bit, not that bad. But look at the hydration, the disc regeneration here, 4-5 and L5S1. I mean, that's again, no drug can do that. So this is the study we published for use of mesenchymal stem cells. That's a bone marrow for low back pain. It's the same, we replicated, but we also used other parts of the back and treated them. And it was Dr. Ekluri et al. And I somewhere we had to have a lot of PhDs who took care of the cell counting and cell analysis. So I'm one of the co-authors for this paper. And our study, this is the end of 12 months, where 67% still had improvement, an ongoing improvement. Now, some of the patients we treated in this study are now into 5 years. And these are the people who still did not have any surgery, got back on with their life. We had patients who came in wheelchair and then get back to work. And then another is knee pain. That's common for patients. Now, here are the studies in knee pain. Intra-auricular injection, most of the conditions treated are moderate to severe. I mean, there are very few places where they're mild and severe. And Dr. Hernigo, he has followed patients for 12 years, and this is the groundbreaking study we'll talk about. Now, Dr. Hernigo used the autologous human body mesenchymal stem cells. He followed the patient for 15 years. Amazing study. 140 patients. On one knee of this patient, he did the replacement. On the other knee of these patients, he did the autologous bone marrow subchondral injection. Now look at the numbers. 105 patients, 82% of the patients did not need knee replacement surgery. And among the patients who had knee replacement, 15% had to have a revision of knee replacement. And he followed the study for 15 years, published in 2021. Now we are up to like 19 years into this. And autologous, only 18% needed the surgery. So let's go to liver failure. It's one of the, again, systemic illnesses. There were about 23 trials, mostly cirrhosis. Positive results in all except 3. Positive outcomes, regardless of etiology. Now that's an amazing. All etiologies come in, no complication, positive outcomes. So it just kind of highlights the stuff they use. It's a prospective control study, and you look at them, the results are all positive. And from ascites to fibrosis to ascites, enzymes, it is a true regeneration of these patients. If you look at these patients under microscope, I mean, look at the fibrosis scarring, all the white fibrosis scarring, and the cells without no nucleus. And the treated patient with placental stem cells, look at that. That's amazing regeneration plus no fibrosis, very little fibrosis. So going down to cardiovascular now, there are about 50 randomized controlled trials I used for this presentation, and different etiologies, same thing. Ischemic cardiomyopathy, myocardial infarction, heart failure, most trials, again, positive results. And these are for the systemic administration, either IV or it's IM. So similarly, ischemic cardiomyopathy, and here follow-up for 3 years, very positive results. Now talking about kidney, again, same old. It's amazing to see this organ systems in our body, whole different etiology, but the treatment pathway is the same. There's absolutely no drug that does that. So how does it work? You give the IV mesenchymal stem cells, and then sometimes you use customized exosomes. They go in the spleen. But this is the most important step. They convert the macrophages, M1 to M2. And then we'll talk a little more about that, and kidney and regeneration. So again, multiple studies, publications on this. So now some people have used for broad spectrum therapy, and that's ischemic strokes. And they have seen like improving the neurological deficits. Activities of daily living increased with the patient with ischemic stroke. Now diabetes, that's, Mr. Patel was talking about this just before me. He's a fellow San Diegan. I live in San Diego also. Unfortunately, I could not come to Naples, beautiful city. So diabetes, he got a Nobel Prize. Dr. Banting got for the discovering insulin. And the question these days is, with the tighter control of blood sugars, does it help with diabetes? Now, British Journal, General Practice, said what they came out with, it's evidence-based meta-analysis, that even if we control less than 7% of A1C, still did not reduce mortality of heart mortality, did not reduce risk of stroke, did not reduce the amputation of limbs, did not reduce the risk of heart failure. But I look at the stem cells, how we do. We use Wharton's jelly or MSCs, small patient population, but decrease the dose, better glucose levels, and then A1C. But here is the same story. Now here is amazing. The paper, 80 years follow-up, decrease in peripheral neuropathy, decrease in diabetic nephropathy, decrease in retinopathy. I mean, this is a cure. It's not just treatment or controlling blood sugars. So to date, there are a lot of clinical trials going on, from trauma to immunology, hepatology, all the systems, about 900 of them. And there were over 8,500 clinical trials in humans, which is an amazing field. Now, the summary is that it's extensive animal data we have on these, which I did not present, but my presentation is all human data. preliminary clinical data, and we need more randomized trials for before it becomes mainstream. So how does it work? I mean, we've seen these amazing things, but how does it work? So after we infuse intravenously, pretty much the stem cells that disappear in a few days. What happens is they don't survive, they don't home, they don't engraft, they don't differentiate. What they do is they transform the host immune cells from a destructive pathway into a regenerative cell. So here we are, our host cells, macrophages, T helper cells, dendritic cells, pro-inflammatory, catabolic, all the factors, inflammatory factors, and the stem cells, macrophages, these cells engulf these stem cells and then gets converted into M2, T helper 2 and DC2, becomes regenerative and anabolic and anti-inflammatory. Basically, it creates a regenerative microenvironment in the tissue. So we all know injury, inflammatory cytokines, and then T cells get activated, goes into cytotoxic T cells or helper T cells. They'll stimulate B cells, and in the end, come down the tissue damage pathway. And here it is, stem cells basically cuts this whole um, tissue damaging pathway into a regenerative pathway. So what they do is this: the converted regenerative immune cells, they enter the circulation and they are the one who go into disease organ. And first thing they do is stimulate the native MSCs. And then through a different immunological pathways, they stimulate T cells, neutrophils, macrophages, B cells, dendritic cells, and make it into a regenerative pathway of the cells. Um, Now, safety. Let's talk about safety. How safe for this? And then remember that we have given these. This is a paper again we published about the safety effectiveness of intravascular mesenchymal stem cells for treatment of organ failure. We're talking about end organ failure. These are the patients who are either severe or critically ill. Very few moderately ill patients, and then and the outcomes were amazing. Like these are comparatively they had no other option other than just controlling. Here we are looking at the regeneration and curative effect. So there are a couple more publication with that. And so stem cells seems to be the future. I mean, we are looking at the different organ. And with regards to the treatment for systemic failure, it seems to be near future. And however, we need more research to be done before it becomes mainstream. And thank you very much. I'll take any questions. All right.
Okay, that was a wonderful presentation. I would like to know what are the potential applications that are currently being used in the market of the human umbilical cord.
So, in the market, as of today, the FDA is not authorized any treatments for systemic human applications. They gave emergency utilization authorization, emergency use authorization for COVID. And during that time, thousands of doses were given, which actually showed improvement in the end organs or multiple organs. So our next, there are some countries which allow treatment protocols. It has been used for autoimmune diseases. Stem cells are champions for treatment for those. It's also used for musculoskeletal diseases, joint and spine. Um, so that's been currently used in many countries. But yet, to the main big organs like heart and liver and lung, it's not yet done. Not any big, uh, commonly used mainstream is not yet there. We probably I would anticipate in next probably few years, more governments are going to look into this data. They're going to look into the move forward with the studies and treatment protocols.
Okay, great. So, what are the potential risks you see about the usage of human umbilical cord? Are there any potential risks?
So the cells and treatment itself, we did not see any potential risk. There are anytime you give cells to patients, there's a risk of like minor immunological issues, which are, but yet remember we gave thousands of doses for patients in COVID, and these are the sickest patients. But any complications or adverse effects of using stem cells were not noted. There are risks in the preparation or manufacturing of stem cells. There were risk of procedural risk, where how they gave it, and but stem cells to the patients. But usually they do not have, by the cells itself, no. However, when we are looking for long-term treatments and repeated doses, we may be looking at what happens when they get, the stem cells given repeated doses. They have a potential, they may sensitize the T cells, and then maybe the B cells activation. So we did not come there yet. Since the cells do not have a HLA expression yet, or express very low amounts, they don't have any immune reactions.
Okay, so when we talk about the dosages, so on what level you see the dosages that can be given to the patients? What is the dosage level?
So that's a good question. So let me answer one more answer for the last question, which is, um, with regards to adverse effects. There were some thrombus or clot activation of clotting system. So they have seen in certain high doses of stem cells, there's a potential to activate the clotting systems and form thrombus. That's one. So the dosages, that's a good question. It depends on the treatment protocol. Number one. Number two is, I mean, you cannot be just using indiscriminately. So for mesenchymal stem cells, you're looking for dosage about roughly about 500,000 to 1,000,000 per kilo body weight dosages. And depending on the severity of illness, it's either given intravenous or it could be given intramuscular. And then sometimes when I used for the treatment protocol for the COVID, I used 1.5 million per kilo body weight, roughly about 100 million cells, because that was the easy one. I just replicated the protocol that came from Florida. And so we gave 3 doses about 2 days apart on this patient. So yeah, the dosages now, I would say definitely depending on the systemic organ failure, anywhere between 500,000 per kilo body weight to 1,000,000 per kilo body weight is safer at a given stance. At the same time, now if you're using it for treatment for multiple organ problems, for example, if you're treating somebody with, say, musculoskeletal problem, a joint, and then you're also administering, say, for example, somebody with either rheumatoid arthritis or psoriatic arthritis. They get into joint injection and systemic. You should be careful to add the dosages. The final dose should not exceed our planned dose. So make sure you do that adequate amount of diligence in treating.
That's great to hear. So, one last question, like, how did the COVID patients respond to this mesenchymal cell treatment?
They so uh, my personal response was amazing. These are the patients, again, like I said, they have severe COVID, they are critical COVID, they were on ventilators, they were using 100% oxygen, and these patients, so they're at that time their mortality is almost like 90 over 94%. So there's 6% of survivability. So we saw about close to 60% survivability of this patient. So depending, again, these are the patients, not just the lungs. By that time, they had kidney failure set in, their heart is not functioning well, and so they are the sickest patient we treated, and then the response came out really well. And it was the same study that was done in Miller Medical School in Florida. So they had the same outcomes.
That's great, Navneet, Boddu. Good to know about your research, and I see it has a lot of potential, uh, and coming to the applications. And wish you all the best for this research. And we would like to know more about this research in the upcoming years from your end. We look forward from you.
Thank you. I thank you very much for giving me opportunity.
Thank you.